Tracy, and this is my assignment for my 500-hour yoga teacher training certificate, and this assignment is on yoga and pregnancy. So the assignment reads, you are subbing a prenatal yoga class. You have women in the class who are in their first, second, and third trimesters. So question number 1, what will you do differently in this class than you would do in other classes? Well, first of all, I'd probably stress out because I would be very nervous subbing a prenatal yoga class. But what I would do differently is I would take some time and really design my class. I would make sure that I would avoid too many poses that are on the belly, or maybe avoid it altogether. Things like cobra or locust pose, I probably wouldn't be comfortable teaching those, even though locust pose is actually really good as like a hip opener, hip strengthener. I would make sure I use support if I was on the back. I would use lots of props throughout the class, lots of blocks, straps, bolsters, things like that, anything that they needed. I'd avoid deep back bends, like camel pose. I would avoid deep twists, really twisting the body. Nothing that would bind, basically nothing that would bind or constrict that abdominal area. I'd avoid hot or power yoga, obviously, but if I was subbing a class, that probably wouldn't be an issue. And then I'd avoid really holding the breath throughout the class, and I would just let the breath come and flow very naturally. And I'd just remember that, ask the women if they're comfortable. You tend to get really nauseous during pregnancy. I know I was. Anytime we did anything where I did prenatal yoga throughout my pregnancy. Anytime we would do something where we would go an example, go from downward dog or uttanasana back into standing too fast. I just dizzy, nauseous. So just kind of check in throughout class, make sure everybody's drinking water, everyone's comfortable throughout. So question number 2, make a video teaching 3 poses for a prenatal yoga class where you can demonstrate modifications for someone who's pregnant. So I chose Malasana, Baddha Konasana, and Parasarita Padottanasana. Those are 3 poses that I just really like. They're just good, solid prenatal poses. They were ones that I really liked. I loved during pregnancy doing Baddha Konasana and Malasana specifically, and I always love a forward fold. So if I were going to teach Malasana to someone who is pregnant, especially somebody who maybe doesn't have a lot of experience, but you really want to get those hips open, I would use a block, especially if they couldn't come all the way down. And again, we would just make room for the baby. We'd have the legs spread a little bit wider, especially if they were in the 2nd or 3rd trimester and the belly's getting large. So I'd inhale up and exhale, and just with the feet wide, I would come down into Malasana. And being careful, making sure my block is aligned underneath, coming to sit, making sure the feet are out, the knees are nice and spread, leaning forward, keeping the spine nice and straight. And again, just adjusting as you need. Inhaling, exhaling, lengthening through the spine, maybe reaching the hands out, pulling the spine up farther, and just making sure this whole pelvic floor pulling up through that Mula Bandha, pulling up through the perineum, and then just relaxing into the position. Another pose that I would teach would probably be Baddha Konasana, and I would make sure that they were comfortable. Again, if you need to sit up on a block or sit up on a little pillow or a bolster, I'd have the legs spread nice and wide, and maybe they can't bring the feet together. That's okay, just drop them out to the side, or say they can, bring them in nice and tight, bring the soles of the feet together, pulling them in close to the pelvis, and then maybe they have to use a nice block underneath, to support the legs. And so just have that nice support system there. Leaning into the posture, straightening up through the spine. Oops, lost a block. And again, leaving the arms out, making room for the baby. In this pose, maybe you'd have to have the feet a little bit wider out to the side, making, again, room for the abdomen. Inhaling, exhaling, sitting up nice and straight and tall. So those would be 2. And then, again, if I were going to go into a forward fold, instead of doing, just a regular uttanasana, because we're having that abdomen, we have the baby in there. So instead, just folding forward like this. Spread the feet nice and wide. Turn the toes in. Adjust the body. Making sure we're all nice and straight. Hips are forward. Tuck the pelvis. And then lean forward. Again, making sure that there's room. Maybe we can't come down as far as we used to because the belly starts to hit the thighs. So again, we use our block. Nice flat back. Nice straight spine. And release the posture. So those are the ones that I would probably teach, and those are the modifications that I would use for those poses. So the next question is, name 10 poses that I would put into a prenatal yoga class if it were themed around hip openers. So my 10 poses I chose would be Warrior One, Lizard Pose, Recline Thread the Needle, Malasana, which we just did, Reclined Pigeon, Child's Pose, Trikonasana or Triangle Pose, Bridge Pose, Goddess, and then I probably would do Locust. I think it is just a really good hip opener, but I would maybe be a little bit nervous about having someone on their tummy. But yeah, that was my assignment. Those were my answers for yoga and pregnancy. So thank you.